Welcome to the deep dive. Today we're tackling a really critical topic for anyone who loves a furry friend, calcium channel blocker toxicosis.
Mm.
These are medications you might have heard of, maybe your vet has even prescribed them, but what happens if a pet gets into them accidentally? We've got a detailed look at this from several veterinary sources.
That's right. Calcium channel blockers, or CCBs, well, they're pretty common in vet med
Right.
for managing things like high blood pressure, various heart conditions,
Hmm.
even some kidney issues in dogs and cats.
Okay.
Now, here's a key point right off the bat. These drugs aren't all the same. Not at all.
Okay, let's unpack this. Our sources highlight that there are different classes of CCBs. Think of them like, I don't know, different models of the same tool.
Yeah, that's a good way to put it.
We've got phenylethylamine, benzothiazepine, and dihydropyridine.
Uh,
And this classification is super important because apparently it dictates exactly how the drug will affect your pet's body.
Precisely. It's crucial.
So, what we're really digging into today is understanding what goes wrong internally when a pet ingests these meds, and maybe more importantly, what are the absolute critical steps to take?
Yeah.
Because this sounds like a serious emergency.
Oh, it is. A life-threatening one.
Mhm.
To really get why it's so dangerous, we need to get down to the nitty-gritty, how CCBs work normally.
Okay.
At their most fundamental level, they block the movement of calcium
Right.
through specific pathways in cells
Mm.
called L-type voltage-gated slow calcium channels.
L-type voltage-gated slow calcium channels. Okay, and these
Yeah.
channels aren't just hanging out in one spot, are they?
No, definitely not.
The info tells us they're in some really vital areas. The heart muscle itself,
Yep, the myocardium.
the AV and SA nodes, which are like the heart's internal spark plugs, right?
Exactly, the electrical conduction system, also the smooth muscle that lines blood vessels,
Uh-huh.
and even, interestingly, the beta cells in the pancreas.
The pancreas too. Okay.
Precisely.
Yeah.
So by blocking calcium from moving into these areas, CCBs achieve their intended therapeutic effects, like lowering blood pressure.
Okay.
However, if there's an overdose, this widespread blocking of calcium channels it throws a massive wrench into how these critical systems function.
So if a pet gets into too many of these, what's the immediate fallout? What kind of signs and symptoms might you, as a pet owner or even a vet tech, start to notice?
Well, the most immediate and, frankly, concerning effects are usually on the cardiovascular system.
Right, the heart and blood vessels.
You might see a dangerously slow heart rate, we'll call bradycardia.
Bradycardia. Okay.
The regular rhythm of the heart can also go haywire. You can get things like AV dissociation, different degrees of AV block, first, second, third degree.
Oh, wow.
And very alarmingly, there could be a significant drop in blood pressure or hypotension.
So the heart's slowing down and the blood pressure's dropping.
Exactly. Think of it like the heart's electrical system and its pumping power, both starting to falter at the same time.
That sounds incredibly serious. And it's not just the heart that's affected then, is it? Our sources indicate problems can pop up elsewhere too.
That's right. It's systemic. In the gastrointestinal system, we could see vomiting, diarrhea,
Okay, typical signs maybe?
but also ileus, which is essentially a slowdown or complete standstill of the intestines, nothing moving through.
Okay, that's more serious.
Yeah. The respiratory system is also at risk. You can potentially get fluid buildup in the lungs, the pulmonary edema.
Breathing difficulties then.
Yes, exactly. And neurologically, a pet might become less mentally alert, weak, could collapse,
Mm-hmm.
and in really severe situations, might even have seizures.
Wow, that's a pretty broad range of effect. And surprisingly, you mentioned the pancreas earlier. The information also points to changes in their endocrine and metabolic systems.
Yes, this is quite interesting. There's the potential for hyperglycemia or high blood sugar
High blood sugar.
from a heart med overdose.
Mm.
It seems counterintuitive, right?
Mhm.
But blocking calcium channels in the pancreas can interfere with insulin release. And you can also see metabolic acidosis.
Acidosis. Why is that?
Well, it often develops because the poor blood flow from the heart problems, the hypotension and poor contractility, means the body isn't getting enough oxygen to the tissues.
Right, poor perfusion.
Exactly. Leading to a buildup of acidic byproducts, like lactate.
This paints a really troubling picture. So if a vet suspects CCB toxicosis, what kind of detective work do they need to do? How do they confirm it?
Well, ruling out other possibilities is absolutely key for differential diagnosis.
Because other things could look similar.
Oh, definitely.
Yeah.
The list of conditions that can mimic CCB toxicity is quite extensive, actually.
Like what?
We're talking about things like overdoses of beta blocker antagonists,
Mm.
or other cardiovascular drugs like clonidine or digoxin.
Okay.
Even sedative overdoses from things like opioids or baclofen can cause low heart rate and sedation. Plus, you have to consider underlying heart issues like sick sinus syndrome or maybe severe electrolyte problems like high potassium levels, hyperkalemia,
Right.
and even severe shock or sepsis can present with similar cardiovascular collapse. So it's not always an open and shut case just based on signs.
So it sounds like a process of elimination is crucial. What about standard blood work? You mentioned glucose and electrolytes. Can that give initial clues?
Definitely. Standard blood work, so a CBC, a chemistry panel, and a urinalysis can provide valuable pieces of the puzzle.
Like?
Well, we might see that elevated blood glucose we talked about, signs of kidney problems like azotemia if the poor blood flow has started to affect kidney function,
Okay, kidney injury.
and maybe even elevated liver enzymes, again, as a consequence of reduced blood supply, hypoxic injury to the liver over time.
Got it. So the basic labs are important. Are there more specialized lab tests that are particularly helpful here?
Yes, blood gas analysis is really crucial.
Why that specifically?
To confirm if there's metabolic acidosis present and how severe it is, it also tells us about oxygenation.
Okay. And imaging?
Imaging, particularly chest x-rays or radiographs, can help us see if there's fluid in the lungs, the pulmonary edema risk.
Right.
And it can give us a rough idea of the pet's overall fluid volume status, like if the heart looks enlarged or the vessels are distended or small.
And beyond labs and x-rays, what other diagnostic tools are important? You mentioned heart rhythm issues.
Absolutely. The electrocardiogram, or ECG, is vital.
Yeah.
Essential, really.
What can that show you?
It looks at the electrical activity of the heart. It can reveal those different degrees of AV block we mentioned.
First, second, third degree.
Yep. And also changes in the timings, the PR interval, the QRS duration, the QT interval, all indicators of how the CCBs are messing with the heart's electrical conduction.
Okay. Anything else, maybe looking at the heart muscle itself?
Yes, an echocardiogram and ultrasound of the heart, that can be really informative too.
How so?
It can show if the heart muscle isn't contracting as strongly as it should be. We call that negative inotropy.
Weaker pumping.
Exactly.
Yeah.
And it helps us assess the overall cardiac output, essentially how much blood the heart is managing to pump out with each beat.
Okay, so a really thorough investigation is necessary to pinpoint the problem and how bad it is. Now let's shift to treatments. If a pet has just ingested CCBs, maybe the owner saw it happen, what are the very first things a vet will likely do?
Time is critical here. If the ingestion was recent, generally within maybe a couple of hours, and if the pet is still alert and stable enough,
Right.
inducing vomiting, emesis can help get some of the medication out before it's absorbed.
Makes sense. But what if they're already showing signs, or it was a huge amount?
Good question.
Mm.
If the pet is less responsive, mentally dull, or if we know a large amount was ingested, then gastric lavage, basically stomach pumping, might be needed. But you have to protect the airway.
Okay.
And for those medications that are designed to release slowly over time, the extended release or sustained release ones.
So XR or SR pills.
Exactly. For those, just making them vomit might not be enough. A technique called whole bowel irrigation might be considered.
What's that involve?
It essentially uses large volumes of fluid, like polyethylene glycol solution, given via a stomach tube to flush the medication through the entire digestive tract more quickly.
Ah, okay. So the initial focus is decontamination, preventing the body from absorbing more drug. What about ongoing support for the pet once they're in the hospital?
Getting intravenous access is paramount. And often placing a central IV line is a really good idea.
A central line. Why specifically that?
Well, it allows for continuous monitoring of things like central venous pressure, which gives an idea of fluid status. It's also essential for monitoring blood glucose frequently, and it provides a reliable, safe route for administering certain medications, especially if we need to use high-dose insulin therapy, which we'll get to.
Okay.
And in some really severe cases where the heart rate is dangerously slow and isn't responding well to medications, temporary pacing might actually be considered. Placing a temporary pacemaker to force the heart to beat at a safe rate.
Wow. Okay. That's pretty intensive.
It is. And of course, intravenous fluids are crucial.
For blood pressure support.
Exactly. For treating the hypotension and supporting overall hydration and perfusion. Our sources have specific guidelines for the rates, the fluid types, with slightly different recommendations sometimes for cats versus dogs.
Right. Now, let's get into these specific medications used to counteract CCB poisoning. Activated charcoal is often mentioned in toxin ingestions. How does that help here?
Activated charcoal acts like a sponge, basically.
Okay.
You give it orally or via a stomach tube, and it binds to any CCBs still in the digestive tract, preventing them from being absorbed into the bloodstream, usually given after emesis or lavage. Multiple doses might be needed for those extended release types.
Got it. What about drugs to speed up the heart rate?
Atropine is one medication that can be useful.
How does that work?
It's an anticholinergic. It works specifically if the slow heart rate, the bradycardia, seems to be originating from a problem in the heart's sinus node, a sinus bradycardia. It might not work for the AV blocks, though.
Okay, so limited use maybe, but the sources really seem to highlight calcium infusion as maybe the first-line treatment, even if the pet's blood calcium levels test normal. Why is that? Why pump in more calcium?
That's a really, really key point. It seems odd, right, if their calcium level is normal?
Yeah.
But the problem is the blockade of the calcium channels. So even with normal calcium outside the cells, it can't get in to do its job properly, especially in the heart muscle.
Ah, okay.
So giving an intravenous calcium infusion helps to essentially overwhelm that blockade. It increases the calcium gradient, forcing more calcium into the cells.
And that helps the heart.
Yes, it's absolutely essential for proper muscle function, particularly cardiac muscle contractility. It helps the heart muscle contract more effectively, improving that negative inotropy.
Okay, so directly counteracting the drug's effect, are there specific types of calcium used?
Yes, typically either calcium gluconate or calcium chloride. The sources give specific guidelines for how to administer them, usually an initial slow bolus dose, followed by a continuous rate infusion, or CRI.
And you need to be careful giving it.
Very careful. Continuous ECG monitoring is vital during calcium administration.
Why is that?
Because sometimes giving calcium can, ironically, worsen the bradycardia or cause other rhythm disturbances. So the infusion rate might need to be adjusted based on the ECG.
Okay.
Also, calcium chloride especially can be really irritating to the tissues if it leaks out of the vein. It can cause tissue damage.
Ouch.
Yeah. So using that central line we talked about is often preferred, especially for calcium chloride.
And is there a target level you're aiming for?
Yes. The goal is usually to get the pet's ionized calcium levels, that's the active form, up to about 1.5 to maybe 2 times the high end of the normal range. You monitor this with blood tests.
That makes perfect sense, directly fighting what the calcium channel blocker is doing. Now, the information also mentions intravenous fat emulsion, or IFE. That's something you don't always hear about for drug overdoses. How does that work here?
You're right. IFE, or intralipid therapy, is maybe less commonly known outside of toxicology circles. It's typically used for intoxications involving drugs that are highly fat-soluble lipophilic drugs.
And some CCBs are?
Yes, particularly some of the dihydropyridines, like amlodipine, are quite lipophilic, and it seems to help even with others.
How? What's the theory?
There are actually a few proposed mechanisms. One main idea is that it acts like a lipid sink or lipid shuttle.
A lipid sink?
Yeah, the idea is the fat emulsion in the bloodstream creates this expanded lipid compartment that essentially pulls the lipophilic drug out of the tissues, like the heart muscle, and traps it in the blood, where it's less able to exert its toxic effects.
Interesting. Any other ways it might help?
Well, another thought is that it can provide fatty acids directly as an energy source for the heart muscle, the myocardium, which is under a lot of stress and energy deprived in this situation.
Okay, fuel for the struggling heart.
Exactly. And there's also some evidence suggesting it might directly help increase calcium levels inside the heart muscle cells, maybe by modulating those calcium channels somehow, which again improves their ability to contract.
So, multiple potential benefits. Are there specific protocols for giving IFE?
Yes, like with calcium, our sources provide specific dosages. Typically an initial bolus given over a few minutes, followed by a continuous infusion for maybe 30 to 60 minutes.
Okay.
And they also mentioned that repeat boluses might be necessary or the infusion might be continued up to a certain maximum total dose, depending on the response.
Fascinating stuff. And then there's a therapy that might sound even more unusual for a heart problem. High-dose insulin, along with dextrose. You mentioned it earlier. How on earth does insulin play a role in a CCB overdose?
Yeah, it definitely catches people off guard initially. High-dose insulin, or HDI therapy, the exact way it works in CCB toxicosis isn't, 100% perfectly understood.
But what's the thinking?
Well, under normal conditions, the heart prefers to use fatty acids for energy. But in severe shock states, like with CCB overdose, the heart switches to preferring glucose or carbohydrates. Insulin helps the heart muscle cells take up and utilize that glucose more effectively for energy.
So it helps fuel the heart again, like the IFE idea?
Kind of, but Maybe more importantly in this context, insulin also seems to have direct positive effects on heart muscle contractility, that inotropy we keep talking about.
How?
It appears to help increase the calcium levels within the heart muscle cells, possibly through different mechanisms than just blocking the channels. This leads to a significant improvement in the heart's ability to contract and pump blood effectively, better cardiac output.
So it's boosting the pump function. Does it fix the blood pressure too?
That's a really important point. Even if HDI improves the heart's contractility and maybe other signs of poor circulation get better, it might not directly improve the low blood pressure, the hypotension.
Yeah.
That might still require other supportive measures like fluids or maybe other drugs.
Okay, so it's more about getting the heart muscle working better, not necessarily just raising the blood pressure number itself. What's the protocol for giving HDI? It sounds like it would require very careful management, playing with insulin and sugar levels.
It absolutely does. It's
Yeah.
very intensive care. The recommended approach usually involves first checking the pet's blood glucose level.
Right.
If it's low or even low normal, you'd give intravenous dextrose first to prevent hypoglycemia before you even start the insulin.
Okay, get the sugar up first.
Then you administer a bolus of regular insulin intravenously.
A loading dose.
Exactly. Followed immediately by a continuous rate infusion of regular insulin.
And you have to watch the blood sugar like a hawk.
Constantly. The rate of the insulin infusion often needs to be adjusted frequently, especially in the beginning, maybe even every 10 to 15 minutes initially, based on serial blood glucose readings.
Wow.
Frequent blood glucose monitoring is absolutely essential. Initially, maybe every 10-15 minutes, then maybe every 30 to 60 minutes once things hopefully stabilize a bit.
And you need to keep giving sugar too.
Almost always, yes. Because the insulin is driving glucose into the cells, you need ongoing dextrose supplementation, usually as a separate IV infusion, to maintain a stable blood glucose level in a safe range.
And that dextrose might need to continue for a while.
It might,
Yeah.
sometimes even after the insulin infusion itself is stopped, because the insulin can have prolonged effects.
Anything else to watch closely with HDI?
Yes, potassium. Insulin also drives potassium into cells along with glucose.
Ah, so blood potassium can drop.
Precisely. Hypokalemia is a major risk. So potassium levels need to be monitored very closely, typically hourly, and potassium supplementation added to the IV fluids is often required.
That definitely sounds like it requires round-the-clock, intensive monitoring, and careful adjustments by the vet team.
No question. It's not something to be undertaken lightly.
Okay. And the last medication mentioned in our sources is glucagon. How does that fit into the treatment plan? Is it used often?
Glucagon is another option. It works by increasing the levels of a substance called cyclic AMP, or CAMP, within the heart muscle cells.
And that helps.
Yes, increased CAMP can increase the force of contraction, similar to how some other heart drugs work. It bypasses the beta receptors that drugs like beta blockers affect.
Okay. Is it as good as the other options?
Well, our sources suggest that it might not be as consistently effective or perhaps as potent as HDI or even IFE in treating severe CCB toxicosis. Its effects can sometimes be transient.
So maybe a secondary option.
Potentially, or maybe in combination. We do have recommended bolus and continuous reinfusion dosages provided in the information if it is used.
It's fascinating to see these different therapeutic angles directly boosting calcium, using that lipid sink idea, leveraging insulin's metabolic effects, and then glucagon's pathway. Now, are there any treatments that the information specifically cautions against using or recommends using only with extreme caution?
Yes, one important point is about relying solely on vasopressors.
Drugs like norepinephrine or dopamine.
Exactly. Those are drugs that primarily work by constricting blood vessels to try and raise blood pressure.
Why be cautious with those here?
In CCB toxicosis, the primary problem is often the heart's poor pumping ability, the negative inotropy, and bradycardia. Just squeezing the blood vessels might not fix the underlying issue and could even increase the workload on an already failing heart.
Right, increasing afterload.
Precisely. So, while they might be needed sometimes as adjunctive therapy if blood pressure remains dangerously low despite other treatments, relying only on vasopressors is generally discouraged. They might not be as effective, and there's even a theoretical concern they could potentially make the patient less responsive to the core treatments like calcium IFE or HDI.
That's a really important clinical pearl to keep in mind. So once the immediate crisis is being managed with fluids, calcium, maybe IFE or HDI, what does the recovery period and follow-up care typically look like? How long do you need to watch these guys?
Continuous and extremely close monitoring is absolutely essential, even once they seem to be turning a corner.
What are you monitoring specifically?
Pretty much everything we've talked about. Keeping a constant eye on the heart rate and rhythm with a continuous ECG, frequent blood pressure checks, monitoring those ionized calcium levels, and especially if HDI was used, very frequent blood glucose monitoring, plus watching respiratory rate, mentation, urine output.
The whole picture. How long does this intensive monitoring need to go on?
It depends on the type of ZCB ingested. For the immediate release formulations,
The ones that act quickly.
yes. For those, this intensive monitoring should continue for at least 12 hours after they seem stable, because sometimes signs can recur.
Okay. And what about the extended or sustained release ones?
For those preparations, because the drug is absorbed more slowly and the effects can last much longer, the monitoring period needs to be significantly extended. We're talking 24 hours, maybe even 36 hours or longer, of continuous monitoring is often recommended.
Because the danger isn't over just because they look okay for a bit.
Exactly. There's a real potential for a delayed onset of signs, or for them to seem to improve and then suddenly deteriorate again as more drug is absorbed or released. You can't let your guard down too early with the SRXR forms.
Understood. And what can pet owners and vets generally expect in terms of how the toxicosis progresses, the timeline, and the overall outlook for the pet? What's the prognosis usually like?
Well, the timing of signs appearing can vary. With immediate release CCBs, you might start seeing clinical signs develop anywhere from, say, maybe 30 minutes to perhaps 8 or 12 hours after ingestion, depending on the dose and the specific drug.
Okay.
With the sustained or extended release versions, as we just discussed, it can take much longer for symptoms to appear. Sometimes 12 hours, maybe even up to 24 hours post-ingestion before you see significant problems.
And prognosis? Is recovery likely?
The prognosis really depends heavily on several factors.
Yeah.
The specific CCB involved, the dose the pet ingested, how many milligrams per kilogram,
Right.
how quickly decontamination and treatment were initiated, and crucially, how well the pet responds to the aggressive therapies like calcium, IFE, and HTI.
So it varies a lot.
It really does. Some cases with small ingestions might just need monitoring and minimal support, but severe cases.
Well, we typically see that progression of symptoms we talked about earlier.
Remind us.
It often starts with the slowing heart rate, the bradycardia, and the drop in blood pressure, the hypotension.
If it progresses, this can then lead to a decreased level of consciousness, lethargy progressing to stupor or potentially coma.
Okay.
And in the most critical situations, if the cardiovascular collapse is profound and prolonged, it can ultimately lead to respiratory arrest, apnea, and death.
So it's abundantly clear then calcium channel blocker toxicosis is a very serious, potentially fatal veterinary emergency.
Absolutely, no doubt about it.
It demands swift recognition, prompt decontamination if possible, and really comprehensive, aggressive, supportive, and specific antidote care.
That's right. Having a good understanding of how these drugs work, the pathophysiology, and knowing about the diverse treatment strategies available, like the calcium, the IFE, the HDI, it's absolutely crucial for giving these pets the best possible chance of recovery.
Definitely. It requires a dedicated team and intensive resources.
It really does. And, when you consider the different ways these main treatments work directly supplementing calcium, the lipid sink effect of IFE, the metabolic and intracellular calcium effects of HDI, it really makes you think, doesn't it?
That's so.
Well, about potential future research. What could we learn about potentially optimizing combination therapies? Is there a best sequence? Does one work better for certain CCBs?
Like tailoring the treatment mix.
Exactly. Or even applying these principles to other complex drug poisonings that affect the cardiovascular system or cellular energetics. It's a really fascinating area where further investigation could really refine how we handle these critical emergencies in veterinary medicine. Makes you wonder what the next breakthrough might be.